After scraping the impression and removing all the excess green stick compound inside the tray, the green stick should be flushing with the tray. No excess material inside the tray. Now, I'm ready to take the impression. Before taking the impression, let's revise the limiting structure for the upper impression. Labial frenum, labial vestibule, buccal frenum, buccal vestibule, distobuccal area, hamular notch, and post-dam area. Now, we will use zinc oxide eugenol material. It is the material that I'm going to use to record the fine details. The upper arch is a little bit large, as you see, so I will take about 2.5 lines from each material. And these should be equal amount. After I place the material, I have to stabilize the glass slab by my one hand and the other hand to mix the material. Don't rush and take your time because you have about 3 minutes working time. Take your time while mixing. You have to hold the glass slab and collect all the material to be sure not only the top is mixed but also the bottom of the material. Slowly, usually mix in one direction so that no air bubble is inserted. After mixing the material, I have to load the tray. Distribute the material all over the tray. First at the fitting surface, then you can start at the borders itself. You can distribute it on the border itself so that the borders is recorded with me. I distribute the material slowly and firmly. Don't panic and don't think it will hurt. I will go to the patient mouth. I stand behind the patient. I rotate the tray. I look. I insert the material and apply force at the middle of the palate, molding downward and inward, downward and inward, downward and inward, downward and inward, and keep holding the material and the tray firm in position. Never to remove your hands. Otherwise, air can be go inside the impression. While seating the tray, usually seat it from anterior then posterior or posterior then anterior. Don't seat it as a one shot. Otherwise, air may be entrapped inside the impression while taking the impression. Keep standing behind the patient. Keep making slight border movement slowly and firm. I have to wait about 4 to 5 minutes until the material sets with me. Don't rush and remove the material, otherwise it will separate from the tray and keep in the patient's mouth. And if the patient has gagging sensation during taking the impression, ask the patient to move his head and side forward on his chest and breathe from his mouth, not to breathe from his mouth, from his nose and not from his mouth. Slowly, I keep border molding until the material set. How to determine that the material set? I retract the tissues and I touch the excess material. If my finger print is shown in the material, it is still soft. I have to wait until it hardens. Take your time and be patient because the material takes 5 minutes to harden. Never to leave the tray inside the patient's mouth and go to check the excess on the glass slab because first the tray may move inside the patient's mouth. Second, because the material itself hardens inside the patient's mouth faster than on the glass slab because the temperature inside the patient's mouth is higher than on the glass slab. I have to wait until the material fully settled and then to remove. To remove the tray, I have to stand in front of the patient. I have to insert my finger and to break the air seal slowly. I remove the impression and I have a look on the impression. You can find that all the borders are recorded by the zinc oxide eugenol, the labial frenum is recorded, the buccal vestibule, the labial vestibule, buccal frenum, buccal vestibule, here labial frenum, labial vestibule. He has 2 buccal frenums. Then the buccal vestibule, then the tuberosity area, hamelar notch, and the post-dam area is recorded. Here I apply a little bit small pressure, and here pressure. This is called a pressure area, but I'm not going to correct it because it is still covered by zinc oxide. It is acceptable. Only if the green stick is showing and no zinc oxide is covering it, you have to correct it. But if it is just a shadow of a green stick is showing, no problem. This is an ideal impression to make a secondary impression. Thank you.